Okay, so welcome to today's deep dive. We are really glad you're joining us for this one because, well, we are getting into a topic that is, quite frankly, a little wild.
It really is. I mean, it's fascinating, but yeah, wild is the right word.
Right. So let's start in the 1950s. There was this German gynecologist who claimed he had finally found a treatment for female sexual dysfunction. And his big medical solution for what he called, quote unquote, frigid women.
Oh, this part is just...
It's brutal, inserting literal hat pins into the front wall of the vaginal canal. Just, a very crude, highly clinical observation that had absolutely nothing to do with wellness or pleasure.
Yeah, completely divorced from how we view these things today.
Exactly. And yet, if we fast forward to today, women are walking into these ultra-luxury aesthetic clinics and paying, like, thousands of dollars to inject cosmetic facial fillers into that exact same spot.
It is a staggering leap. I mean, we went from a mid-century doctor literally experimenting with hat pins to this booming modern industry of, vaginal aesthetic procedures. And the marketing surrounding these procedures is incredibly persuasive.
Persuasive and honestly really confusing. Like, if you are looking into this for yourself, you are going to hit a massive wall of conflicting information. And that is exactly why we're pulling apart this specific stack of sources for you today.
Yeah, we've got quite the contrast on the desk today.
We really do. On one side, we have these incredibly slick, glossy marketing brochures from aesthetic gynecology clinics, places like Dubai's Perfect Doctors Clinic and Dr. SW clinics in London. And they are promising all these things like rejuvenation, wellness, enhanced intimacy.
Right, very appealing buzzwords.
Totally. But then on the other side of the desk, we have peer-reviewed medical journals and these very severe, uncompromising guidelines from the American College of Obstetricians and Gynecologists. ACOG, basically. Yeah. And they are essentially telling doctors, do not do this.
Yeah, you're basically looking at a head-on collision between a very lucrative, rapidly expanding cosmetic industry and, well, mainstream medical orthodoxy.
Yeah.
And caught right in the middle is the patient.
Yeah.
Right? Just trying to figure out what is actually happening to her body.
Exactly. So our mission for this deep dive is to cut entirely through all that clinical jargon and the cosmetic marketing spin. We want to answer the specific question you asked us to look into, which is, what exactly is the G-Shot? And most crucially, if you get this procedure, does it actually affect your hormone levels or your fertility?
Which is honestly the perfect question to ask, because answering it forces us to look at this intersection of modern cosmetic trends, a pretty bleak history of medical neglect, and just fundamental human biology.
Yeah, it really touches on all of it.
But, to understand what the G-Shot does or what it doesn't do, we first have to define exactly what this needle is even targeting.
Right. The target, the famous G-spot, or if we're using the formal medical term derived from our hat pin doctor, the Grafenberg spot.
Exactly. Dr. Ernst Grafenberg is the namesake there. But as you noted, his 1950s research was not about discovering some magical button for pleasure.
Not at all.
It actually wasn't until the 1980s that a completely different team of researchers coined the term G-Spot and propelled it into the public consciousness. They basically rebranded this vaguely defined area into an anatomical holy grail.
Right, which brings us to today. And we have this procedure called the G-Shot, formerly known as G-Spot Amplification. And looking at the clinic literature, like from Dr. SW clinics, the actual physical mechanics of the procedure seem relatively straightforward, right?
Yes, on a mechanical level, it is. Doctors use a speculum and local anesthesia to inject a filler directly into the tissue.
Okay.
The sources mentioned they often use hyaluronic acid, specifically citing a brand called Novia Rose, or sometimes they use human-engineered collagen or even platelet-rich plasma, PRP.
And the placement of this injection is highly specific, isn't it?
Very specific. They're injecting this filler about 4 to 5 centimeters inside the anterior vaginal wall.
Okay, let's ground that spatially for a second. The anterior wall. So, if you are visualizing the internal anatomy, we are talking about the front wall of the vaginal canal, right? The side that's facing up toward the belly button.
Precisely. That's the spot. And the whole mechanical goal of injecting filler into that specific front wall is to create physical volume.
Right.
They're trying to plump that localized area until it's roughly the size of a quarter in width and about a quarter inch in height.
So it's essentially like getting lip fillers, but applied to the inside of the body. Like you're creating a physical localized speed bump to just increase friction and accessibility during physical intimacy.
That's a good way to picture it, yeah.
But wait, I have to stop and ask a fundamental question here. Is this filler targeting a distinct scientifically proven organ? Like, is the G-spot an actual gland they're injecting into, or is it just a general area of tissue?
Ah, that is the million-dollar question. And the scientific literature we reviewed is incredibly conflicted on this. You have highly respected experts like the neuroscientist Terence Hines, who famously referred to the G-spot as a quote-unquote gynecologic UFO.
A gynecologic UFO. I mean, that's funny on the surface, but it's actually pretty alarming when you realize these clinics are charging people a premium to perform medical procedures on an anatomical myth. Like, how do you inject filler into a UFO?
Right, and that's exactly the tension here. Hines means it is heavily discussed, constantly searched for, but entirely unverified as a distinct standalone anatomical structure, like a kidney or a lung,
Okay, but women are experiencing something.
Yes, and you cannot entirely dismiss the physical experiences of women either. The sources point to a study from the University of Aquila that utilized advanced ultrasound technology.
Oh, really? What did they find?
They found that women who consistently experience vaginal orgasms statistically have noticeably thicker tissue in that exact anterior wall area compared to women who do not.
So there really is a documented structural difference for at least some women.
Yes, but whether that thicker tissue is a specific standalone quote-unquote gland, or whether it's just a really complex, dense convergence of nerves and the internal network of the clitoris, well, that is still fiercely debated in the medical community.
Wow. Okay, so if the underlying anatomy is still being debated, it makes evaluating the actual procedure incredibly tricky. Which, I guess, leads us directly into the core of what we're analyzing today.
Exactly.
The big question you wanted answered. If someone goes into a clinic in London or Dubai and gets this G-shot, does it fundamentally alter her hormone levels? Does it impact her fertility?
I can give you a definitive, unequivocal answer based on all the medical and clinical sources we reviewed.
Okay, let's hear it.
No, the G-shot does not alter your hormone levels in any way, and it absolutely does not impact your fertility.
But wait, look at this source from the Crete Fertility Center. They are this massive, highly advanced fertility clinic, and they advertise the G-shot right on their website.
They do, yeah.
So, if a world-renowned fertility clinic is offering it to patients, it has to be tied to conception, right? Why else would a fertility clinic do this?
See, that is exactly why this cosmetic marketing is so incredibly effective, and why we have to read the fine print of these medical brochures.
Okay, break it down for us.
If you look really closely at the Crete Fertility Center's documentation, they offer a massive range of advanced treatments that do actually impact fertility. Things like targeted IV drips with antioxidants to improve egg and sperm quality, or stem cell therapy for ovarian rejuvenation.
Right, actual fertility treatments.
Yes. But the G-shot is listed in a completely separate category.
Oh, wait. Let me guess. As a wellness procedure.
Exactly. It's a supplementary wellness add-on strictly for sexual enhancement. It has zero bearing on your ability to conceive. It will not help an embryo implant. It will not improve egg quality, and it won't change your reproductive timelines.
Okay, so that totally rules out the fertility angle. But the hormone question is where the phrasing gets incredibly slippery to me. Like, the brochures use words like rejuvenation, revitalization, and restoring youth.
Right.
Those words sound systemic. They sound like they're treating the underlying biological clock.
But it's entirely spatial and mechanical, not systemic. The Dubai Clinic source explicitly states that their vaginal fillers, quote, restore volume and hydration without altering hormone levels.
Ah, okay.
When a doctor injects hyaluronic acid, that acid instantly binds with water molecules in the surrounding tissue to create physical volume. It holds moisture. But it is completely inert in terms of your endocrine system.
So if a woman is experiencing a severe drop in estrogen during menopause, this shot isn't giving her any estrogen back.
Not a drop.
I'm trying to think of the right way to visualize this. So hormone replacement therapy, HRT, is kind of like watering a dying plant so the roots recover and the leaves grow thick again from the inside out.
Yes, exactly.
So the G-shot is just taping plastic leaves to a dry stem. I mean, it looks and feels fuller in that one specific spot, but the plant itself is still biologically dehydrated.
That is an incredibly accurate way to look at it. Because HRT is a systemic medical treatment. It changes the cellular makeup of the tissue over time, by actually replenishing the estrogen and testosterone your body stopped producing.
Right.
The G-Shot just adds a temporary, non-hormonal pocket of volume, and your body will just naturally dissolve it in about 4 to 6 months anyway.
Okay, so if the G-Shot doesn't fix the underlying hormonal drop and it does absolutely nothing for fertility, why is there such a massive consumer demand for it? Why are so many women, specifically women going through menopause, seeking this out so aggressively?
Because the biological shift these women are experiencing is profoundly disruptive. The sources detail a condition known as GSM, that's genitourinary syndrome of menopause.
Okay, what does that entail?
As you age, your natural estrogen and testosterone levels just plummet. And estrogen is the hormone responsible for keeping vaginal tissue elastic, thick, and well lubricated.
Makes sense.
So without it, the tissue literally thins out. It loses its blood supply.
Yeah.
This is a condition called vaginal atrophy.
And vaginal atrophy physically changes the structure of the body. It causes severe dryness, a loss of physical sensation, and like actual pain during intimacy.
Exactly. So these women are dealing with a severe structural spatial problem, thinning tissue and a loss of physical volume. And it's fundamentally caused by shifting hormones.
Wow.
But the thing is, not everyone can take hormone replacement therapy. Some women have medical contraindications, like a history of certain cancers, or they simply aren't being offered HRT by doctors who just aren't trained in menopause care.
That's incredibly frustrating.
It is. So they're seeking out the G-Shot as a mechanical workaround. They're desperately trying to replace the physical volume they lost, the hormonal aging, with just a syringe of hyaluronic acid.
Women are in pain, they want solutions, and the clinics are right there promising them life-changing results. They're promising intensified orgasms, natural lubrication, and even claiming it fixes mild urinary incontinence.
Right, all the things they want to hear.
But then you turn the page to the mainstream medical establishment, specifically the American College of Obstetricians and Gynecologists, and they are aggressively slamming on the brakes.
Yeah, ACOG takes an incredibly severe stance in the texts we reviewed. They explicitly state that there is absolutely no valid medical reason to perform a G-Shot.
None at all.
None. It is not FDA approved for this use. And their exact phrasing is that performing this procedure is untenable to recommend.
Untenable. I mean, that is an incredibly aggressive word for a standardized medical body to use. Here's where it gets really interesting to me. If this is just hyaluronic acid, like the exact same filler people get in their cheeks or their lips every single day, why is ACOG so violently opposed to it?
Well, because the vaginal wall is not the cheek or the lips. It is a highly complex, incredibly vascular area of the human body.
Right.
ACOG outlines some severe potential risks. They warn of sexual dysfunction, severe infections, and permanent scarring. They also highlight the risk of dyspareunia, which is the medical term for painful sex.
Wait, painful sex? The very thing women with genitourinary syndrome of menopause are going to these clinics to cure.
Yes, injecting a foreign substance into a dense bundle of nerves can totally backfire and cause chronic pain instead of pleasure. But the most alarming risk detailed in the sources is a reported case of a pulmonary embolism caused directly by a vaginal hyaluronic acid injection.
Wait, a pulmonary embolism is a blood clot in the lungs. How on earth does a cosmetic injection in the vaginal wall travel all the way up to a person's lungs?
It comes back to how vascular the pelvic region is. It's packed with a very dense network of large veins and arteries.
Oh, no.
Yeah. If a practitioner makes a mistake, like if the needle slips and they accidentally inject that thick gel-like filler directly into a vein rather than the surrounding tissue.
It goes into the bloodstream.
Exactly. That gel can travel straight through the bloodstream, reach the lungs, and block a major artery. It is a rare complication, yes, but it is a catastrophic, potentially fatal risk.
Hold on. If ACOG is publishing papers warning about pulmonary embolisms and permanent scarring, how are these clinics not being shut down? Like, how is it perfectly legal for them to market this as a quote-unquote safe, organic fix on these glossy brochures?
It all comes down to a major regulatory loophole in modern medicine known as off-label use.
Ah, off-label use.
Yeah. Those hyaluronic acid fillers, like Nuvia Rose, are fully FDA approved to be injected into your face to smooth out wrinkles. Under current medical regulations, once a product is approved for one area of the body, doctors have the legal leeway to use it off-label anywhere else in the body.
As long as they think it helps.
Right, provided they believe it will clinically benefit the patient. The aesthetic clinics are operating entirely within that regulatory gray area.
They are essentially saying the FDA says this gel is safe for human bodies, so we're going to decide where to put it.
Pretty much.
But let's look at the actual patient outcomes for a second. Even with ACOG's warnings and the risk of embolisms, thousands of women swear by this procedure.
They absolutely do.
The clinics have walls of glowing testimonials from women who say it saved their marriages and totally revolutionized their sexual health. Are they all just experiencing some sort of collective delusion?
No, not at all. Their experience of enhanced pleasure is very real. But the biological mechanism driving that pleasure might not be the hyaluronic filler at all.
What do you mean?
Well, the Moorgate Andrology source explicitly notes that many experts believe the shot's success for a significant number of women relies heavily on the placebo effect.
The placebo effect. We usually talk about the placebo effect with, like, headache pills or cold medicine. How does a placebo effect work in sexual health?
Because the brain is, without question, the largest and most powerful sexual organ in the human body. Think about the psychology of the patient here.
Okay.
A woman is struggling with intimacy, perhaps dealing with the real pain of menopause. She actively seeks out a specialist, pays thousands of dollars for a medical procedure, and feels she has finally taken control of her sexual health.
Right, she's proactive.
So when she goes into an intimate encounter, she fully expects to feel more sensitivity.
And because she expects it, her brain physically responds differently.
Exactly. When she expects the procedure to work, her brain's alpha waves actually slow down. Her background anxiety drops significantly. She is able to be fully present in her body without anticipating pain or failure, which vastly increases the physical likelihood of reaching climax.
Wow.
The physical filler might just be acting as a psychological permission slip for her brain to finally relax.
So the brain is doing the work, not the hyaluronic acid.
Yeah.
But that raises an even bigger, honestly more troubling question. Why is there such a desperate market for an unproven, potentially risky off-label procedure in the first place? Why are women so willing to be the test subjects for a gynecologic UFO?
That desperation stems from deeply ingrained societal pressures. And it is compounded by a staggering historical lack of medical research on female bodies. The sources provide statistics regarding the quote-unquote orgasm gap, and they are incredibly revealing.
Yeah, the numbers and the sources really lay bare why this industry is booming. Studies show that 95% of heterosexual men always climax during sex. 95%.
It's a huge number.
Compared to only 65% of heterosexual women. And the statistic that really underscores the psychological pressure, 67% of women admit to actively faking it.
We really have to ask why 67% of women feel the need to fake their physical responses.
Right.
It's because society has largely defined normal sex around male biology. Specifically, the expectation that penetration alone should reliably and easily lead to climax.
Which just isn't true for most women.
Biologically, only about 20% of women can climax from penetration alone without direct clitoral stimulation. So you have millions of women who genuinely believe their bodies are broken because they don't respond the way society and the media tells them they should.
And instead of the medical community stepping up and saying, hey, maybe our definition of normal sex is just too narrow, these women are walking into clinics to surgically alter their internal anatomy just to try and fit that narrow male-centric definition.
Precisely. And the mainstream medical establishment has to take a massive amount of the blame for creating this environment of ignorance in the first place.
Definitely.
According to our sources, the United States National Institutes of Health only began officially researching vaginal health in 1992.
1992. I mean, that isn't ancient history. We had personal computers and space shuttles, but the NIH was just starting to look at basic female anatomy.
It was exactly a full century after the male orgasm was first formally studied by the medical establishment.
That is just mind-blowing.
The historical blind spots are astonishing. The sources note that even some relatively recent medical anatomy textbooks completely omit the clitoris from their diagrams.
Literally leaving it out.
Yes. They mapped every inch of the male body, but completely left out a female organ that contains more nerve endings than the penis and exists purely for the function of pleasure.
If the medical textbooks are literally erasing entire organs, it makes total sense why a woman would feel lost and turn to a cosmetic clinic for answers. I mean, is the G-Shot basically just a modern surgical Band-Aid for a society that fundamentally refused to understand female anatomy?
That is a highly accurate assessment of the situation.
Yeah.
And it's exactly why the World Association of Sex Coaches offers a completely different prescription in our sources.
What do they suggest?
They argue that before a woman seeks out surgical amplification for a perceived abnormality, the most powerful and revolutionary thing she can do is simply look at her own vulva in a mirror.
Just bypassing the clinic entirely and looking at their own anatomy.
Look at it and learn to use the correct anatomical words. Learn the structural difference between the vulva, which is the external genitalia, and the vagina, which is solely the internal canal.
Yeah.
Understanding your own biological reality is often far more effective for sexual health than a syringe of off-label filler.
Which brings us to the ultimate psychological danger of the G-Shot trend. It isn't just about the physical risk of a pulmonary embolism. There is a massive mental toll to this kind of marketing.
Yes, absolutely. As the sexologist Vincenzo Pupo argues in the texts, telling women that they have this magical hidden G-spot that needs to be amplified might actually be doing profound psychological harm.
How so?
Well, if a woman pays thousands of dollars for the shot, undergoes the injections, and still doesn't respond to penetration the way she thinks she is, quote-unquote, supposed to, it can make her feel deeply, permanently inadequate.
Oh, that's heartbreaking.
It takes a natural, healthy search for pleasure and turns it into a brand new source of extreme anxiety.
It just reinforces the idea that she is broken rather than questioning the map she was given.
Exactly.
So let's pull all these threads together. If you are researching the G-Shot or considering it as an option, here is the absolute bottom line from the sources we reviewed today. It offers a localized cosmetic plumping of the vaginal wall aimed entirely at increasing physical friction. But to answer your core question, it absolutely does not alter your systemic hormone levels, and it does not affect your fertility in any way whatsoever.
It remains a highly controversial, medically disputed procedure. It is firmly condemned by major medical bodies due to severe risks. Yet it is kept alive by a very real, very understandable desire among women to close the orgasm gap and find relief from the symptoms of aging.
It is a mechanical spatial fix for a societal and hormonal problem. But looking at everything we've uncovered today, from the 1950s hat pins to the omitted textbook diagrams, there is a broader implication here.
There is. Considering that major medical institutions have historically erased female anatomy entirely, and the G-spot itself is still debated by top scientists as a quote-unquote gynecologic UFO,
Yeah.
it forces you to wonder, what other fundamental aspects of your own body might modern science be completely misunderstanding simply because no one has bothered to look closely enough yet?
That is such a good point. Usually we trust the map of human anatomy to guide us. We expect absolute precision. But today it is incredibly clear that when it comes to female sexual health, the map isn't just murky. In a lot of ways, it is still actively being drawn. Keep questioning the map, keep asking these brilliant questions, and we will catch you on the next deep dive.